everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And just want to inform each one of you, we are really sorry. We have to go, today Instagram live only because we are just not able to go on Facebook, and there is some glitch in the Facebook, and that is the reason we are late today as well, 11 minutes late. And so we are here on our Instagram page, The Social Doctor, discussing with you certifications and fellowships in Obs Gynae. And today we have a very special guest. So we have a very special guest, Dr. Charachur Konar. He is a specialist in Obs Gynae and is currently working as an assistant professor in Sri Devraj College. He is also a contributor in the DC Dutta books. So a very popular book since 4 decades, a book that every undergraduate and postgrad student has read, the DC Dutta's textbook of obstetrics. The current version has been published now, and he is a valuable contributor into it. So welcome, Doctor, to the platform. It's really nice to have you here.
Thank you, ma'am. Thank you very much for those kind words. Really appreciate that, ma'am. So I'm very glad that you have given us this platform to, to tell us regarding these fellowships and certificate courses in Obs and Gynae. And it's been a good pleasure for us to be associated with you and to be on this platform. Thank you, ma'am.
Thank you so much. Equally, we are so happy to have you here, sir. So starting with, as the topic is fellowships in Obs Gynae, what do you think are the different, fellowships that every student can go for and can think of after their post-graduation?
Ma'am, Obs and Gynae, a little about Obs and Gynae, it is comparatively a smaller subject than the other ones. If you see medicine, surgery, pediatric, they are relatively bigger subjects. Obs and Gynae, it is a small subject. And although fellowship and certificate courses are there, a lot of those things during your post-graduation times only you learn of. So if, for instance, laparoscopy, for instance, primary management of an infertile patient, for instance, urogynecology, little bit of repairs of the perineal trauma in the wound, and little bit of assisting oncosurgeries, radical hysterectomies, and all of that. So a lot of these things, the basic idea of it, you get during your post-graduation times. And apart from that, now that we have both certificate courses as well as we have FNB courses, FNB and MCH in certain of those topics. So now depending on the student preference, ma'am, for instance, after post-graduation, a lot of people, they want to do with fellowships and certificate courses. They want to join a lot of courses. Now, and as we were discussing beforehand, I have come across a lot of big professors who have given long hours of lectures on what is to be done. Now, I won't go into what is to be done, because those category of students who know what is to be done and what is not to be done, they have sorted their things along. Now, I would concentrate mostly on those people who are confused, people who are like me, who are confused and who do not know what is to be done. Now, confusion arises because of the number of options that we have. So we'll come to the list later, what all can be done. So confusion, number one, is because of the number of options that we have. And secondly, confusion is good. It is good to be confused. I am also confused. A lot of people are confused what is good for them, what is bad, and how do we go ahead. And during this confusion times, I got a very good advice from my father. He told me, once when you are confused, you stick to the basics. You do not go and do whatever you want, because since you're confused, you will not find peace of mind in that. So you join to the basics, you do the basics, and then you decide for yourself what is driving you, what is better for you. So I will just discuss what I thought was important and what I have done, rather than giving an outright, lecture on what is to be done, because I don't think I am that much qualified enough to tell all your viewers. So what I have done is, after when I finished my MS in OBG, I also wanted to join one endoscopy certificate course. It was a 6-month course, and two of my friends also had joined. So seeing them, I also wanted to join. But then again, I was a little confused because once you are doing OBG, surgery is an integral part of your course, and open surgeries is what they teach you a lot in that subject. So I thought whether or not to go for that course or to stick to the basics. So my father told you join SRship, do open surgeries first, and then you decide for yourself whether laparoscopy is driving you, or you may find interest in fetal medicine, or you may find interest in reproductive medicine. So I joined my SRship. I started doing open surgeries, which I think sitting today, it is very important prior to you go to any big course, because if you do not know the basics of open surgery, then it becomes difficult. Okay, so basic open surgery we started doing, following which, as I was telling you, a lot of professors in my college, they were well versed with laparoscopy. So with them only we started assisting in laparoscopy, and going on ahead today, the basic procedures in laparoscopy I can very well perform. However, the very advanced laparoscopy surgeries, I would need assistance, but however, the basic things I can do. So that is how I decided once I'm done learning the open surgeries, I'll go ahead and do the laparoscopy course. So as of yet, I have planned that I will do some laparoscopy course. I have not joined as of yet, but soon I will. So for those students who are confused what to join, what not to join, if you are confused, you join with the basics, start your basics, understand the market around you, understand the world around you, talk to your seniors, assess how they are doing, and finally you will decide what is correct for you.
So, now discussing, as you discussed laparoscopic, what are the best places to go for laparoscopic, and, India as well as internationally, if you can discuss from your experience?
Ma'am, laparoscopy, as we were discussing, ma'am, laparoscopy, they have the certificate courses. Certificate courses, they are given by institutes as well, and they're given by the Indian society that we have, that is the ICOG, the Indian College of Obstetrics and Gynaecology. Now, these certificate courses in Delhi, as you are in Delhi, I'll tell you of the World Laparoscopy Center. It is a very good place. A lot of my friends and my brothers, they have got themselves trained from there. They give up the fellowship as well as the diploma certificates from there. So that is a very good place to go. Apart from that, currently, as I'm in Bangalore, I have learned of 2 places in South, in Kerala. One is in Kochi, the other is in Trivandrum. There is one there is one Sunrise Hospital there. That Sunrise Hospital also gives very good laparoscopy training. Now, there is the ICOG certificate courses in every state in India. The ICOG has appointed 2-3 hospitals and colleges wherein they issue the ICOG certificate courses. There also the person can enroll and get those certificate courses. The ICOG certificate courses, it is little. It is not very different. The standard procedures you learn everywhere, the things you will do the same everywhere. But then, the 2 categories are different. One is the ICOG, the other is from the institute themselves. So like that, there is not much difference. But however, you see, if you ask me, I will prefer the World Laparoscopy Center because I have got a positive feedback out of that, and hopefully in the future I'll join there only.
Great. So now when you mention the laparoscopic, surgeries of World Laparoscopic Center, you also mentioned fetal medicine. So that is also one branch that people plan to go, and a relatively new branch. So
relatively new branch, and if you ask me, it is a little complicated branch as well. A lot of things and procedures are there in that branch. Now, fetal medicine, they have an FNB course in that also. Now, the FNB, that again has to be done 2 years, and you have to work there to get that degree, for which you will get that FNB in fetal medicine. Now, fetal medicine, it is a bit complicated because you will be dealing with the fetus and a lot of procedures you will be doing. Um, and you will be doing that in very highly specialized centers. Not all centers in India, they provide facilities to fetal medicine, and very less people are there who do the who know and do it perfectly. Now, medicine as a branch, it is very good. I have one colleague who is doing a fetal medicine in Safdarjung Hospital. She's doing a fellowship there. So it is a very good branch. You can try with that. But well, if you ask me, I have decided to go with laparoscopy only. I somehow I don't think fetal medicine is good for me. I have as I was telling you, once you are done with your post graduation, once you see the world outside yourself, you decide a niche for you, and then you decide what is good for you and what not. Because you see, when and you may also agree with me, when you were and I both were child, our parents, they told us either medicine or engineering, so either of the two. Now, at this point, after doing post-graduation, I don't think that pressure is there from parents. You have to do infertility or you have to do fetal medicine. It is up to the candidate. It is up to the student to decide what they have to do. Now, how to decide that? It is based on their personal experience and their personal thought and their understanding of subject and their interest, most importantly. So, see, as we were discussing, you have the fetal medicine, you have reproductive medicine. Okay, reproductive medicine means that management of infertility and infertility, reproductive medicine. Okay, apart from that, you have urogynecology, wherein you do the surgery of urogynecologists. Then you have endoscopy, minimal access surgeries, and then you have something again new which has come up, which is the cosmetic gynecology. Okay, yeah, and the laser surgeries and all of that. That is one of very new. And last, you have the gynaecology.
Correct.
Okay, gynaecology, they have the MCH. After post graduation, you can go ahead, give the NEET SS exam, and then you can go ahead to getting a gynaecology. Gynaecology deals with the completely opposite spectrum of what you do. For instance, in obstetrics, you counsel the patient about birth and all of that, but oncology, again, you counsel them about mortality, morbidity, and all of that. So it is a completely opposite spectrum of patients that you will be doing, and I felt that it requires a little bit of mindset change as well. And again, gynaecology, it is a very difficult branch. MCH exam you have to crack, and then you have to 3 years of course you have to do, and finally become a MCH in gynaecology. Now, all these courses, be it an FNB, be it an MCH, what you finally do is you devote yourself to a particular stream, be it fetal medicine, be it reproductive medicine, be it gynaecology. So you devote yourself to that particular field only. And general obs and gynae practice becomes very less for you, because since now gone through all that hurdle to get yourself into an advanced position, going back to basics and normal becomes a little difficult. So again, I come back to the same point. I thought I will finish off with the basic things first, and then according to my choice, I'll go ahead with the advanced. So according to my thing, I thought laparoscopy would be good for me. And I'll go ahead with that.
No, that's true. So, with here, we are also discussing what are the kind of opportunities when we pursue different branches for our audience, discussing that with our audience. What do you think that reproductive medicine, fellowship helps them to pursue, or an infertility or a minimal access or gynaecology, something that you think the kind of opportunities open up for them is something we try to discuss here.
Yeah, ma'am. This way, as I was telling, it depends on the candidate, what is their need, what they want to enroll themselves in. What I thought was best key before going to anything, just do the basic and then go ahead. For instance, if you want to go to laparoscopy, you be acquainted with the basic surgeries and then open surgeries and then go ahead with the laparoscopy, because if there is a failed laparoscopy, you have to open and do. So that way. On oncology, if you go ahead, oncology in your post-graduation times, you people may have assisted a lot of onco surgeries. Yes, cancer cervix, it is a very common problem in India in the females because of whatever reasons. So gynec surgeries also they have assisted. Now they have to devote themselves to onco surgery. Now onco specialists in India, they are less. Lot of work is going on in the cancer space, in the oncology space. Tata Memorial Hospital, both in Calcutta as well as in Bombay, they provide very excellent services. They have great doctors, great surgeons. In fact, where I am working, there is one onco surgeon. He does very good surgeries. He's a, and for every onco patient, the way he counsels the patient, the way he gives hope to the patient, that is too good. And onco surgeries, as I was telling you, there are less number of people who go towards onco surgery. So onco surgery is something which will interest a lot of people. So onco surgery is one good thing. Then urogynecology is also a newer thing to do, in that you have the urogynecological problems starting from mass per vagina, prolapse issue, or urinary incontinence, or repair of the pelvic floor and all of that. So that is a newer thing again. And then they have certificate courses for that as well. I have done myself one certificate course in urogynecology, that from the Royal College, and they had done a workshop for 3 to 4 days wherein they had shown us a few procedures and they gave us a hand-on facilities as well. So I have done that, and you have a certificate course for that as well. So urogynecology is also something which is good, and urogynecology problems we face day in and day out. For instance, master vagina prolapse associated with stress urinary incontinence is a very common problem, and the management is little tricky provided you know the entire anatomy and you know the way of repair. But yeah, so it's like that, ma'am. And fetal medicine, as we were telling you, very advanced centers, very advanced machines, very advanced techniques you need for that. And most importantly, fetal medicine is not a one person job. Fetal medicine, if you do, you need at least a group, a team, a specialized place where you can do. It is not like you become a laparoscopy surgeon, you go to any hospital and you do up the surgery with one assistant. You need a specialized place, your faculty, your people to help you around and do that procedure. So it's a combination and a group of people who come together and do the fetal medicine thing. Then you have urogynecology again. Now one person can go and do up the surgery. Laparoscopy, it is a one-person job. Gynaec onco also, primary surgeon will be one, and then you have the assistant people who will do all of that. So it is like that. And the newer thing which has come, which is the cosmetic gynecology. I personally have no much idea into that, but then that is a newer thing, and the laser surgeries are also coming up. So maybe we'll get more clarity in the future how it is working out and what is the scope of that. So as of now, these are the few.
Any place, if person wants to, inquire or know any place that helps in certifications, and or anybody who is doing good in it, people can connect with.
In which one, ma'am?
Cosmetic gynecology.
Cosmetic gynecology, ma'am. There is one center in. There are two centers I came to know of. One center is in Bangalore. It is called Indian Laser Society. I'll put on the description. I'll send it to you. You can put it in the description box. And one more center is in UAE. Yeah, okay. It's in Dubai. That is also one center which I came to know of. The details I have forgotten. I'll provide it with you. You can share it in the description box.
Sure. So when it comes to infertility and reproductive medicine, so this is something that many people go for. And especially
so infertility, it is a very, very, very good branch. Infertility management starts from your post-graduation days only. Basic workup of an infertile patient, the basic way it has to be treated, everything from the post-graduation only they come to know. It is the advanced management of infertility, for example, up till IUI, up till intrauterine insemination, a postgraduate will learn and do. But beyond IUI, you have something called ICSI, which is IVF and ICSI, which is in vitro fertilization and intracytoplasmic sperm injection. So these are the things which are advanced IVF centers provide. The protocols of drugs and management of infertile patients that changes with patient to patient. It is not a standard protocol for every patient. There are some characteristics which are to be seen and following which the management is given. So, so those things again will require the infertility specialist. For that infertility, it is a very good branch, and a lot of people I know of, they have enrolled themselves in infertility courses. In Bangalore, we have one very good center, Professor Kamini Rao. She's a very well-renowned infertility specialist. She has her center where she offers fellowship courses as well as FNB courses. So that can be looked into. Apart from that, one of the pioneers in infertility in India, Professor Dr. B.N. Chakravarti, he is no more now. He recently passed away. He has one center in Calcutta itself, which is called Institute of Reproductive Medicine. I am very fortunate that I have a certificate from him. I have done a 6-month course in infertility from him as well. And I'm very fortunate to have my certificate signed by him. So that is that. So infertility, again, I was telling you about fetal medicine, that also requires a teamwork, that also requires a center. It is not an individual person's job. It requires a lot of investment as well as time. Otherwise, you can go yourself and join some infertility center. So that also can be done. But if you want yourself to open one center, it will require a lot of arrangement for that. So that way, it is not a one-person job.
So before, you also mentioned that you have done this Royal College of Surgeons examination in urogynecology. Sorry. So this is something that, if you can enlighten, if somebody wants to do, how can they do, and how can they go around it?
Okay, so what I had done was, you see, every now and then there is one society called the AICC RCOG, All India Congress, associated with the RCOG. RCOG is the Royal College of Obstetrics and Gynaecology. So they have their conferences. So when they have their conferences, they do the workshops. So a lot of workshops are there. For instance, in our field, we have workshops on laparoscopy, both advanced, even not even that. In just January, this month, January, first week of January, we had the All India conference for OBG. It's called the AICOG. It was held in Calcutta. You have workshops. The first day was the workshop day, wherein you had a lot of workshops. A lot of eminent faculties, not only from India, but also globally, would come. They'll teach you, they'll give you hand-on experiences, and they'll show you how it is to be done. So that one certificate course I had done, that was from the RCOG, and it was done by someone called Abdul Sultan. He is the person who had given the classification for the perineal tears and trauma. So he had conducted a workshop from the RCOG side, and it was a hands-on training. And they about perineal trauma and the TOT tape we had learned, and it was a good experience. It was good. So RCOG, you can visit on the RCOG website. Every now and then they come out with these announcements of where the workshop is and what topic it would be and where it would be, what is the time, what is the duration. So every detail will be getting on the RCOG website only.
Okay, nice to know this. So now, when you have mentioned all of these different specialities, so if you can help somebody, so this also depends on where do you want to settle down. So there are times that people want to settle down in their hometowns, and then there are people who want to settle down in their metros, understanding that the kind of opportunities and the kind of technology metros have. So what do you suggest for people who wants to settle down in their hometown? What are the kind of fellowships or certifications they should go for, and what they should not go for? For example, you mentioned that fetal medicine needs a huge teamwork. So should they go for that or not? If you can help and explain that, please.
Uh, you see, ma'am, India is a developing country now. Every center, every place now, they have higher facilities, they have advanced systems, and they have made certain things mandatory for the hospitals. If you run, you should have an ICU, you should have oxygen, you should have this. There's a lot of things which are mandatory now to for a hospital also. Now, as I was telling you, fetal medicine. Now, fetal medicine, it is a thing which requires specialized people, specialized unit, a setup, a lot of people, and they do very complicated procedures, and that too on the fetus or the baby. For instance, there is something called chorionic villus sampling. Okay. There is something called amniocentesis. There is so these are there's something called intrauterine transfusion. So they are very specialized things which are done by specialist people. Now, if you particularly talk of, and these are most centers are mostly in the cities, because the ability of all the facilities are better in the cities, as you may understand, for obvious reasons. Now, and all the centers, the big centers, if you see, they are mostly in the metros and all of that. So the inside towns and the tier 2 cities, they also have centers, but then sometimes they refer patient to the higher centers. So it's like that. So, however, the basic treatment can be provided at a tier 2 place. But then, if you want to, get involved in, well, instead of referring patients, if the person wants to do, I think it is better to do it at a bigger center. But however, laparoscopy and all, it is as I told, it is a surgery. So that can be done in everywhere. That can be done. That is not an issue. Okay, but fetal medicine, for example, infertility, as I was telling you, the protocols of infertility management, the drugs, there are a lot of complications with them, which may or may not be managed properly, adequately at a smaller place. So, I mean, there is a preference that I think it is there, but it is not key. It is very absolute, and it has to be done at a main place and cannot be done otherwise. So, yeah.
Okay, so according to you, people who want to get settled down in smaller places, laparoscopy is the best thing that they can go for.
No, it is no, ma'am. It is not like that. Laparoscopy is the best. Everything you can do. But if at all something happens, you should be able to manage it at your center.
You should have access
to backup and access and facility. It can be done anywhere. I mean, so please don't misinterpret that. I mean, it can be done anywhere, everywhere. But then you should know the complications. Everyone will know what are the complications, and if it is able to manage within that center, it's good enough.
Okay. So what I understand is that you need to have a team and people who are in your access in case.
Yes, sir. Definitely.
Yes. So now, understanding all of these different specialities, what we can do post our post graduation and get specialized. What do you think is the right time? As you mentioned that you wanted to go, but you took a break to understand the open surgeries. What do you think is the right time to go for these kinds of certifications? Because most of the people plan this during their PG times only, that, post passing out, they will go for this before settling down, or after passing out, because of the era of super specializations, they are under pressure to actually go for all of these fellowships and certifications. This is a very important thing. So what do you suggest to all of these post-graduation students who are listening to you and who are on that zone of, we should go for this or that? What do you suggest to them?
Ma'am, you see, there are two types of students. One who know what is not to be done, and the others who are confused. I fall into the second category. I am a confused person. The people who know what is not to be done, they have their life settled. They know what not to do, and they will leave them separate. Okay. For people like us, I gave myself time to understand see, when you are a student, you do not understand how the patients behave, what they want, what the market is behaving, what are the current changes, what are the current trend, and where to go and what to do and what not to do. Once you pass out, you get a very broad, wider picture of the society around. you get to meet new people, you get to see how things are progressing, you get to you get feedback from other people, your fellows, your seniors, your juniors, how they are, what they're doing, what was their experience, and all of that. So getting that feedback is important. Maybe at the back of the mind, I always know that I will do laparoscopy, because I didn't want to do onco surgery, because as I told, it was the other end of the spectrum. I did not have that mindset to counsel a patient about mortality, morbidity, and all of that. I didn't want to do infertility because it didn't really interest me. Neither did fetal medicine, because I thought it was a lot of effort. And again, as a single person, I would not be able to make that entire setup and do that work all by myself. So I wanted something which I myself can do and not be dependent on others. So I thought laparoscopy would be a good choice for me. Now, there were a lot of places I searched for, a lot of courses also, starting from a 1 week course, 1 month, 6 month, 1.5 year, 1 year. So like that, a lot of courses are there. So I was again confused which one to join. First, I was confused what to do. Then I got confused in which one to take. Then I thought, okay, fine. In the meantime, I was getting some opportunities with laparoscopy surgery in my hospital. Only a lot of professors were doing. I got to assist them. I tits and bits I got to know. Then again, I thought, okay, fine. Let me go with the laparoscopy. I'll do the 1 month course, and then if required, we'll do. There is one society which is called the IAG, the Indian Association of Gynecologic Endoscopists. This is an association which trains you with the endoscopic surgeries. They have a lot of programs throughout the calendar year. You can enroll, the students can enroll themselves in that society, and they'll get notifications of which is the next place where they will do the training. They give both basic and advanced endoscopic trainings. So, and laparoscopy is basically a surgical skill. You learn it from either your professor, or you go enroll yourself in a 1.5 year course and learn. It is basically the same thing. But then that confidence has to be developed. So for the time being, I know how to do the basic procedures, but for the advanced part, I'll enroll myself in some of the courses and I'll get it done. But yeah, so I have not decided on the time as of yet, but yeah, very soon I will.
So apart from that, one more thing I wanted to know, as you are associated with medical colleges, you are currently there in Bangalore. Now you're shifting to, to the different medical. Yes. So what is your experience as working in medical colleges, or you think, settling down your own practice post graduation is the right thing to do? So I'm sure you can see both sides of the spectrum, your friends who have settled down in their own practices and you now working in the medical colleges. What do you think, are the pros and cons of both areas?
Okay. So again, then there are two types of people. One who wants to be associated with medical colleges, and the other wants to set up their private practice. Right. So corporate life, basically. So there are two categories again. Now, medical college, joining in a medical college, it is the safest thing to do just after passing out, because you get seniors to guide you. You get advices from seniors, and there is no blame. If anything at all, there is an issue with whatever, there is no blame passed on to you. In corporate, firstly, when you just pass out, you won't be given a consultant post. You will be given a post of a junior resident, wherein you will have to work there for pretty long number of years till the hospital or the corporate finds you credible enough that you can pull in patients for them. And they will give you your chamber and all of that. So that is a very long procedure. Medical colleges, there is a lot of freedom, in the sense that I felt. I have not joined any corporate. I know of the corporate culture, but then I have not joined any corporate as of yet. I have from beginning only. I have done senior residency and then assistant professor in the medical college only. The freedom is more. You're doing work, and the guidance that is more. Your security is more. Okay. So people, if they want to, be safe, okay, then I think medical college is the best thing to do. In corporate, you can again, then it is again a perspective change.
Yes,
They
that's
want. Okay, so what I have done, I'm sharing with you. But then people who join corporates, they have their own defenses, they have their own way of explaining things. I would refrain from that debate. It is not basically a debate, it is about a perception, what they
yes,
feel.
it's a personal choice. That's true. So,
Yeah, so yeah, so
yes.
that.
So we were just asking why did you pick up and what are the kind of pros and cons? And I'm happy to know that you shared those. So now getting on to, the book, the new book that you have just launched in obstetrics, a book that is there for more than 4 decades. And now the updated version is out there. What do you think are the new changes that has been brought up in the book, and why should people go for this new textbook of obstetrics by DC Dutta? What are the new changes that students can find in that?
So, ma'am, this is a 10th edition of the book. And as you mentioned, for 4 decades, the first edition was way back in 1983. Since then, a lot of time has passed. The book has seen a lot of changes, a lot of perception change in the field of medicine, a lot of advances in the field of medicine. Okay. So again, then as we were associated with medical colleges, we were very frequent touch with all the students, be it MBBS students, be it the interns who are getting ready for their NEET PG preparatory exams, and then the postgraduate students. So all sorts of students we had in touch with. We spoke to them, we understood what they want, what problems they are facing, and how we can make it simpler and easier. So about this book, ma'am, this is a book of one of its kind. I mean, I don't think any book in uh, India, I'll make it more specific, in obstetrics, has this sort of a layout and this sort of an approach to subject telling. For instance, we have complementary videos which we have given the student access to. In those videos, the person will get access to lecture series, case presentations, animated videos for better visual understanding and easy memorizing. Along with that, what we have done is we have given, for the NEET PG perspective, we have given the last 5 years topic discussions. We have discussed that. Along with that, for the postgraduates, in that lecture series, we have given the obstetric long case discussions, and both of them are in the form of a PDF. The student can take a printout of that and go through it, and while reading the book, they can also mark their answers and read accordingly. Along with that, ma'am, inside the book, we have placed a lot of QR codes inside of the chapters. Once the student scans those QR codes, he or she will be able to access some recent advances, which is linked with another recent advances book of the same author.
Okay.
He won't be able to read the entire chapter from that. He'll get a glimpse of that chapter. And if he's interested and wants to read more, then he can get hold of that book as well. Along with that, ma'am, as I was telling you, NEET PG entrance and post-graduation entrance examination, it is a hell lot of effort the student has to put. For NEET PG, they have to read 16, 17 subjects. For post-graduation, they have to read a lot of books, big books, a lot of information and all of that. So what we have done is we have firstly made this book updated till November of 2022. So whatever the latest guidelines and whatever the recent changes have been there, they all have been incorporated. And to make it easy for the students, we have done those changes in bold. We have kept it in italics and highlights, so that once the student opens that chapter, if he reads only the bold lines, he will understand that this is new, or this is important, or this was asked in the post-graduation exam, or for the MCQ exams, or the viva versa. So that way, the reading has been made simpler. We have seen the effort the student goes through, so we thought we will make it more simpler, more easy for them to read. And night before the exam, just if you go through those bold things and the highlighted things, that will be more than enough.
Great. Very nice to know, especially now with the changes in the way kids are studying and reading. And it's just not textual, it's also, video-based learning, which actually
No, so ma'am, so what our intention was to make at least this subject, this topic more easy and not to take all the hassle and read multiple sources, multiple platforms, join this, subscribe to that. No need. You follow this book. You have access to videos in that. You have access to the NEET PG or obstetric long cases in that. You have access to your highlighted points in bold italics. So if you just follow one book, at least this subject will be made easy for you.
That's
So
really,
that was our intention, and yeah.
that's really nice to know. And, I'm sure all of our viewers are really happy to know about this book, this new book that you have launched. Also, can you mention how can people buy this book, the DC Dutta textbook of obstetrics, the new version?
Ma'am, this book is available at your nearest bookstore, which you will find anywhere, wherever you are studying. Otherwise, on Flipkart and Amazon, both of the places it is available. So you can log into your Amazon account and then search the book and get it.
Yes.
So that way, it is very easy to get the book.
Correct. So this is what doctor has mentioned. So the book that he has just contributed in the DC Dutta's textbook of obstetrics, the 10th edition, the newest edition. Do if you get a chance, do go through it. It is just a one book with everything into it for all the undergraduate and postgraduate students. So and also he mentioned to me, if you want to get in touch with him, they are there on their Instagram page by the name. So I will tag those Instagram page in our Instagram channel. I will also tag that already on our post. I will tag it again. Also, I will mention the email ID in our description, on which you can connect with them in case any doubts with the book or with anything related to Obs Gynae. He's there to help you and to guide you with any kinds of doubt, with establishing fellowships, certifications, or anything with Obs Gynae, any kind of guidance. So, thank you so much, doctor, for all
Thank
the
you,
guidance
thank you.
and
Thank
all
you, ma'am. Thank you.
Yes, and all the guidance and all the knowledge that you have passed on with us to all the students out there. It's really, I'm really happy that we can actually do this.
Thank you, ma'am. Thank you for your time. Thank you for all this effort that you have taken today. And I am very glad that we have come in this platform and had a touch to see all of you and your viewers. And it was a great experience. Thank you, ma'am. Thank you very much.
Same here. Thank you so much, everyone. Thank you for joining. And we will share, as I mentioned in advance, we could not go live on Facebook, as mentioned previously. We will share this video on our Facebook and YouTube channels today itself. You can go through it. Also, do share with your friends and colleagues who are pursuing Obs Gynae. I'm sure this will be very helpful for them to understand when should they go for certifications and fellowships and what are the right fields for them. So gaining something from Dr. Charachur's experience might really help them. So thank you so much, everyone, for joining. Thank you so much, sir. And meeting you again in our next.
Sure.
Yes.
Sure, I'm sure.
Yes. So, to all our viewers, also meeting you again in our next session on the coming Sunday at 11 a.m. again. Thank you so much, everyone.
Thank you, ma'am. Thank you.